For joining uh, the webinar. So let's just give it a few more seconds and we'll get started. Thank you. Good afternoon, everyone. My name is John Sullivan. I am State and Local Policy Director for the Gulf Coast Office of Enterprise Community Partners, and happy to be here with you today for this webinar, Services and Housing and Opportunities to Strengthen America's Public Health Infrastructure. If you could go ahead and introduce yourself in the chat, we'd love to know who's here. So if you could just start by putting your name, organization, and where you're zooming in from. We will be recording this webinar for you and emailing that recording out. And just some notes for you. The chat function will be used more in the webinar. We will have a series of questions that we'll pose to the audience, so please use the chat function for those responses. And if you have any questions, please use that question Q&A box there on the screen to ask any questions, and we'll get to those at the end. Before we get started, I wanted to thank our partners in this work. We had a very generous help from Wells Fargo, who funded this work, and Dynamic Solutions, who provided guidance on the issue briefs. So we're going to talk to you today about some issue briefs we put together around resident services and health and health providers. This project really came about as an offshoot of the Wells Fargo Housing Affordability Breakthrough Challenge. There's a organization here in New Orleans where I work that called the Gulf Coast Housing Partnership, who presented an innovation to get managed care organizations for Medicaid to invest in the development of affordable housing. And what we really wanted to do is look at the resident services side and see if there's an opportunity to get similar engagement and similar investment from Medicaid managed care organizations in funding and investing in resident services. So that is what we will be talking to you about today. We have some great speakers. Amanda House-Harris, Senior Director, Community Impact and Resident Engagement for Enterprise Community Development. Romy Hall, Director of Healthy Homes and Communities at NeighborWorks America. And then kind of my partner in crime in putting together these issue briefs, Mary Ayala, who's Senior Program Director of National Programs at Enterprise Community Partners. So, like I said, we're going to be presenting to you on a couple of issue briefs, and then we will get into a panel discussion with Amanda and Romy. It should be very informative. But let's start off with Mary Ayala, who's going to talk through the first issue brief.
Great. Thank you so much, John. And it's nice to see so many folks joining from across the country to talk about this. I think it speaks to how relevant a topic it is. And so we really see these issue briefs as an opportunity to share what we've learned as we've explored a couple of these different topic areas, and hopefully support others as they move forward in the work of cross-sector collaboration around affordable housing services with the healthcare sector. And I think we really see these as a start to the conversation that we can then move forward. So we've titled them under the role that affordable housing services can have to our public health infrastructure in the United States. And we really see the first as one that focuses in on making the case for this. And when we start looking at the case making around why affordable housing services could be so important to the public health infrastructure in the United States, I think health equity is a great place to start. So one thing that we know already is that health equity in the United States has never been achieved. And this is in large part due to underlying systems of racism that have created barriers to awareness, access, and utilization of health services, utilization and access to our housing system, access to education, the list goes on, and it has created health inequities that are experienced largely in communities of color, and that we think housing-based services could be a large part of supporting a movement towards health equity in the US. So when we think about the cost of these inequities, it's clearly most apparent in the years of life lost and the years of kind of healthy and well life lost as well. There are studies that have put an economic cost to this as well. And there's an estimate that over $15 billion is spent on health inequities by Medicare in this country, and over $2 billion by Medicaid. So traditionally, when we're looking at this as a need that needs to be addressed, we're often looking towards the healthcare sector. They're the ones that the economic costs are spent to, and where we think a lot of cost savings can come. And so Medicaid managed care organizations are often at the center of this: hospitals and health systems, public health departments. However, I think it's important to realize that these are often the same types of systems that have in the past folks have had trouble accessing, that have not been equally available to people across this country. And so how do we start broadening the conversation and looking towards non-traditional partners? And that's where we really think that housing-based services and service providers can come into the conversation. And so one of the things that we did for this series of issue briefs is interview a series of high capacity affordable housing service providers around what their common practices are, how they're funded, where they see barriers, and how they really took on caring for their residents during COVID. And we wanted to share those learnings with you all today as we kind of make the case for a more systems level way of delivering these services within housing. So one thing that was very clear through our interviews is the way residents are centered by the resident service providers that we spoke with. They indicated over and over again the need to really build trust and relationship as part of program delivery. That is tied to ensuring that you know your residents, that you've assessed their needs, and that you're looking towards the needs of a whole person or a whole family, rather than looking towards, specifically, how do we help keep you in housing, for example, or how do we deliver this one health service? So it's much larger focus on the whole person and the variety of social needs that exist for them. And that is a shift that we're seeing within healthcare as well. So I think it aligns nicely, and that we can look very much towards resident service providers as experts in how do we do this, and how do we match the programming and the on-site services to those needs. When just getting a sense of kind of the most common needs that are addressed within resident services, you can look at this slide real quick, but we have the connection to government assistance, education. We heard from a lot of folks that they were providing the on-site virtual school during COVID, that also housing stability, connecting folks to rental assistance and other housing stabilizing programs and services has been really important just generally, but was exacerbated during COVID. Similarly, there was a breadth of health and well-being services that were being delivered on site, from vaccines to education to health fairs, et cetera. And the list goes on to just meet the social needs that residents were sharing that they had at the time. So we raise all of this to really illustrate that the field of resident services is already very resident focused, is implementing equity-based practices in many situations. However, when we started to look towards what are the limitations and what are the barriers in this work, funding came up quite often, that there's a limitation in just the sustainability of these services and programs and supports, because funding is so often tied to philanthropy and year-to-year kind of grant cycles, and that often that can be one of the reasons that they have to shift from the focus on the resident to the focus on what the funder would like to fund. So I think that when we're kind of speaking about moving towards how resident services could be integrated within our public health infrastructure, how can we maintain this resident-centered focus, but create more capacity and sustainability for these programs? And I think it's really that some of this uncertainty in funding, along with the knowledge that there's so many great health outcomes and impacts that come from this, that have folks looking towards the healthcare industry. And so as we move to the next question, or to the next issue brief in the next slide, we're going to start thinking through, when you're not looking necessarily at the system level, but when you're looking just to certain types of organizations, what are some of the barriers? But before we do that, we do want to put a question to the audience. So we've presented kind of a very ambitious vision here of how resident services could be integrated into our public health infrastructure. And I would love to hear from folks who are on this webinar on what they would wish to see as a part of that vision. So if you could fill in the sentence, I wish ... to allow for ... We would love to hear from you. And we really think that we're just scratching the surface here, so that there's lots of opportunity to start to work together around this and integrate new ideas. All right, and I will let folks kind of chat and share in the chat box as we move to the next slide around Medicaid managed care organizations. John, do you mind moving us to the next? Awesome. All right. So when we're looking for growth opportunities for service delivery within affordable housing and Medicaid partnerships, I think we have a lot to learn. As I mentioned before, Medicaid managed care organizations have been a kind of common organization that folks have turned to see if there's opportunity for sustainable funding. And I think the reasons for that are good ones, in that a lot of the healthcare savings that will result from this on the ground work will return to the Medicaid organizations. Additionally, they have indicated interest in affordable housing through investments in the development of affordable housing. And they cover large populations within the United States, and therefore, there might be more opportunity around sustainability and scale. So Enterprise has worked a lot with Medicaid managed care organizations. We've worked a lot with organizations who have also worked with Medicaid managed care groups. For this series, we interviewed a couple of Medicaid managed care organizations to better understand their why as well. And then, spoke with some of the resident service groups about this too. So that is where our learnings are coming from. And when we're really looking towards what have we learned as we've tried to create replicable models for funding of services in housing with Medicaid, I think, of course, we run into a lot of the same barriers that you see in all multi-sector partnerships. So where we need more level setting, more understanding of the other sector and what we're really talking about when we dig in. But there are also some unique roadblocks, but also opportunities as we're trying to pose in the issue briefs in these types of cross-sector partnerships. So to just dig in, there's misalignment at the organizational level between offering services in a place-based model for MCOs. So if you're looking at offering housing-based services, a significant portion of that building may not be a member of the Medicaid managed care group, because within every state you have multiple Medicaid managed care organizations covering the population within the state that is receiving Medicaid. You might also have residents who are receiving employee-based insurance plans, or have alternate paths of health insurance. So when you're really trying to bring together the case making and any sort of ROI types of situation, it can be very difficult to make that case as you structure this work. So we see that there might be opportunity to explore models that are within markets where an MCO has an exceptionally high market share and would therefore cover more of the residents within any one housing site. And I think that this is a really exciting idea as well, is there are more and more organizations that are interested in a collective model that looks to share the risk and the cost of delivering services on site. So that would be where you kind of get buy-in from a group of Medicaid managed care organizations and share that cost based on market share or based on the actual members who are living in the building. And a really neat example of this is happening in New York City around integrated pest management services. So it's a little bit different than what we're talking about here, but it's a great example to look towards how risk has been mitigated through a set aside of grant funding, and then they were able to work in a collaborative way across all of the Medicaid managed care organizations serving residents in New York City and develop a pilot to deliver this one type of housing-based services. A second area that needs to be overcome is just that housing-based services are often seen as duplicative for Medicaid managed care groups. They often have their own case management organizations staff that are available to their members to do a lot of the similar kind of referrals and networking that resident service providers or case managers might do on site. And so that's where I think when we look to this larger discussion around systems, is there opportunity to really think through the best location for case managers and that type of provider for a resident? Is it on site? Is it through the Medicaid managed care organizations? Is there opportunity there to kind of rethink where we can meet people to get them connected to the services that they need to move towards health? And then the last barrier is really one that centers on the lack of regulation, market pressures, or financial pressures. So there is not a clear case to be made at this time as to why resident services should be funded by Medicaid managed care organizations. And so I think that that's really important as we look towards the right place to make this case and where we want to go in the future. So we have seen more investment in the development of affordable housing, that guarantees a return, and there's more kind of traditional models and risks assessments associated with that. So John is going to speak a lot more towards kind of where we might be able to tweak and create more incentive at the local or state level. And for now, we just want to kind of leave you with a couple of other ideas if we want to move to the next slide on where we can go. And this drew from our partners at Gulf Coast Housing Partnership, who have worked with Medicaid managed care organizations closely, along with the other areas that I already mentioned that informed this work. And so the first step, I think it speaks back to starting small, starting with partnerships within the existing structures that exist for affordable housing and Medicaid managed care organizations, so that we have clear opportunities for relationship building, trust making, and starting to get to know each other's sectors. Second, let's make sure we're documenting and sharing impact whenever we are creating partnerships and whenever we are setting up these models, so that we can start to, as a field, better understand the outcomes that are being moved, as well as the cost savings. And then lastly, how do we make sure that we're always open to learning? And that speaks back to just these two sectors are extremely aligned in terms of mission, but extremely different in terms of structure. So we really have to have the time and the willingness to stay in there, ask the questions of clarity to move us towards partnership. And with that, I'm going to hand it back to John to share the final. Oh, I'm sorry. Also, if y'all could share in the chat an answer to this question. In your work, where are conversations taking place around streamlined funding for resident services, social services, or social determinants of health? We'd love to hear kind of the where you're having these conversations and the level of those conversations as we think through where we might be able to move forward from here.
Thanks, Mary. And as those answers come into the chat, I'll continue to our last issue brief before we get to our panel, entitled Possibilities for Synergy and Policy Alignment in Medicaid and LIHTC. And this issue brief really goes to that question of funding that Mary brought up, and how do you really scale these types of collaborations between MCOs and affordable housing and resident services providers. And really a big piece of that, if not the biggest piece of that, is going to be promoting policies that either mandate or really kind of incentivize those types of collaborations. So we looked at a couple programs, of course, the Medicaid program on the health side, and then on the housing side, we looked at the low-income housing tax credit program, which is the nation's largest program for the production and preservation of affordable housing. Both of these programs are federally funded, but they're administered at the state level. So you're looking at state level policymakers, the governor's office, state agencies, and state legislature, in some circumstances where you're kind of making that push for different policies. And when you look at the entry points to these programs, for Medicaid, it's the contracting process to procure MCOs and its waivers. So, like Mary said, MCOs are already providing services, and whether that's case management or kind of different types of activities. And if you look in their contracts, or the procurement documents, the RFPs, that sort of thing, you'll see where states are really pushing MCOs to provide those services. And a lot of times it's mentioning the social determinants of health, using that language, or just kind of using lots of language around what are things that are the non-clinical activities that are not related to direct medical care, but that Medicaid agencies think, if their services provided to those clients, they can save money on the health services side. So you'll see those embedded in the contracts and the RFPs, like I said. So there's opportunity to kind of look at that language and see how resident services might fit into what the state agency is already asking for. Those contracts are usually pretty short term. I think usually about 3 years, and obviously very lucrative and competitive. And MCOs are going to be looking for every advantage they can get. So if you can show where resident services fits into getting them points, or kind of a way to help them fulfill the provisions of those contracts, that is something that they will be incentivized to do, because that is a very competitive process. Another thing we looked at are waivers. And waivers in the program allow states to innovate in ways not traditionally allowed under the federal rules. You have demonstration waivers that allow pilot programs that enhance or promote coverage and efficiency. Then there's home and community-based services waivers, which allow beneficiaries to receive long-term healthcare benefits at home or in community settings outside of institutional settings. So both of these waivers have been used by states around the country to provide housing and supportive services for targeted populations. And shifting to the low-income housing tax credit program, resident services is kind of has a more direct relationship to that program, since we're talking about, developing affordable housing. The qualified allocation plan is basically the application process for developers to get that funding. So you'll see references to resident services in those documents. We looked at the states that I work in, Mississippi and Louisiana, and both of those have, resident services provisions. The state of Mississippi actually requires all developments to provide resident services and incentivizes provision of service coordinators and service providers within developments. And then looking at the state of Louisiana, they have points for targeting special needs population, like homeless, disabled, veteran, that sort of thing, and then a requirement to provide supportive services if you're getting the points for that category. So again, this is also, LawTech is also a program that's very competitive. The developers, applicants are going to look for every edge they can get. So if you can show them these types of services or these types of collaborations can help you, they'll be more likely to try to pursue those types of collaborations. So some of the recommendations that we came up with really have a lot to do with some of the obstacles and barriers that Mary mentioned earlier. So one, determining overlapping populations. This really goes to the problem, as Mary mentioned, about the lack of understanding whether, residents of affordable housing are also clients covered by certain Medicaid MCOs. And so we just encourage partnerships and data sharing between programs, between the Medicaid program and low-income housing tax credit program, to really dig into that and figure out what that overlap is between the residents of LIHTC developments and the Medicaid population. Use competition as an incentive. Again, talk to the competitiveness of both programs. Again, MCOs and developers, they're going to be looking for every edge they can get. So if you can show how those collaborations, will help them get awards, then you'll be more successful. Build on existing alignment between Medicaid and LIHTC. Again, we mentioned the waivers, so you can use those waivers for supportive services that would build support for expanded collaborations. And then lastly, focus on data and outcomes. So this is really about, aligning MCOs and affordable housing providers under the common cause of saving money. I think the services component for MCOs is more directly to saving money than it is for affordable housing providers. MCOs are definitely seeing those services as, ways to cut down on healthcare costs. It'd be great to kind of build up that evidence space on the affordable housing side as well, and show how resident services are actually good for the bottom line of operators of affordable housing, whether that's in the form of more housing stability and kind of less unpaid rent and that sort of thing. So the question we have for you all before we move to the panel What innovations have you seen in your state to create synergy between affordable housing and healthcare? And as you go ahead and answer that question in the chat, I will start our panel. Again, we're very pleased to have Amanda House-Harris with Enterprise Community Development and Romy Hall with NeighborWorks America, who can both speak to resident services and work in looking at health and the kind of convergence of health and housing. So Amanda and Romy, thank you very much for joining us. I'm going to ask a question to you both. Just very generally, if you could introduce yourself and your journey within resident services and housing for Amanda, and then health and housing for Romy. Amanda, if you want to start us off.
Sure. Thank you, John, and hello, everyone. My name is Amanda House-Harris, and I'm Senior Director of Community Impact and Resident Engagement for Enterprise Community Development, which is an affordable housing provider, owner-operator working in the Mid-Atlantic. And my journey, pretty much my whole professional career, has been in affordable housing and tied in some form or fashion to resident services with the past, 15 plus years. So it is essentially, been embedded in my professional career and something that I, still very much enjoy and get passion from on a daily basis.
Hi, everyone. I'm in Oakland, California. So good morning to those and good afternoon to others. As John shared, I'm Romy Hall, and I'm the Director of Healthy Homes and Communities at NeighborWorks America. NeighborWorks America is a national intermediary. We have close to, 250 affordable housing and community development organizations, a part of our network. They're in every state, Puerto Rico and DC. And largely what brings us all together is that our network are active in producing, creating, rehabilitating affordable housing, supporting home ownership, having comprehensive community development to resident services and more. And how I found myself at this intersection of health, housing, community development was really working through two network organizations of NeighborWorks Beyond Housing in St. Louis, Missouri, and the East Bay Asian Local Development Corporation in Oakland, California, doing collective impact work, and really through engaging residents and talking about the different ways that they were identifying barriers to their health and community. And it just wasn't, things like a walking path or diabetes programs. It was just so much bigger than that. It was housing and grocery stores and quality schools. And through those organizations, through their collective impact approach of working with other organizations and in partnerships with residents, I really started to see when you can work on these multi-fronts, you are really creating the opportunity for moving health, and particularly the social determinants of health. So I just kind of happened to fall into this work after getting my master's in public health, and then through working on the ground in community as sort of a backbone manager in multiple collaboratives. That's really how I came to see the social determinants of health along with health and housing. And because working at CDCs who own affordable housing, having colleagues in resident services and doing all of the things that Amanda, you shared, and John and Mary really illuminated in the opening slides and the briefs that you've produced, and how important that is to stabilizing communities.
Great. Thank you both for sharing more about what brought you to this point. I think it's so important that we kind of build on our full breadth of experience as we move forward in this work. And the next question first is to Amanda. Amanda, do you mind delving a little bit more into ECD's approach to resident service delivery, how you've seen it evolve to be more resident-centered, And if you can speak to the impact that you see around health and well-being in the residents that are served.
Sure. So for those that are not familiar, Enterprise Community Development, or ECD, as we often refer to it, our Resident Services Department focuses our efforts on delivery in 4 areas, those being education, economic, security and mobility, health and wellness, and resident engagement. And those are the areas where we center and concentrate the majority of our efforts in bringing, by way of oftentimes partnership, programs, resources, services, and referrals to our communities that as much as possible are in alignment with the expressed interests and needs of our residents. And that is key and critical because what we try to be extremely cognizant of is that we are not making assumptions about what is quote unquote needed in community based on any particular, population demographic. We really want to be partners with our residents as much as possible to support them in the opportunities that they seek to realize their goals. And so we want to be a partner in that process. For ECD, that has been a continual thread for many years. Resident engagement has been an explicit impact area that we have called out to help ensure that as much as focus is, placed on the type of programming that may be brought to community or those connections that are offered to residents, that we also lift up the approach in which we see our residents as partners. And I know many of our peer organizations, do the same as well. And so I think the outward facing, focus now is just becoming a little bit more clear, even though it's kind of been happening in the background. And so really bringing that resident voice and ensuring that it is a part of the decision-making process is key and critical to us. And when we see kind of slippage by way of approach, whether, on our own behalf, just, kind of taking our eye off the ball, or by our partners in other departments in our organization, we start to lift back up those concerns to ensure that we have the opportunity for a resident voice as much as possible. And then by way of impact, on the health and well-being of residents and staff, services in general, those that we kind of focus on, ideally are helping to support the whole resident. And so whatever a resident, when we are engaging with them, or a collective group of residents where we have broader alignment, we are addressing areas that while it may not explicitly in many of our eyes be tied to health in particular by way of like a health program, we understand that all of these areas do have impact on the health and well-being by way of the resident. Because if the resident is stressed or concerned about a particular barrier that they are experiencing, that they're not able or have not been successful in kind of finding resources to address, then that does have impact on their health, even though it may not have been, our partnership with the School of Pharmacy that's coming in doing health checks. It is the gap in, childcare or a financial stressor that also is having impact on that household or that resident. And so us being a partner and supporting them in that process supports their health and well-being as well.
Thank you so much, Amanda. And I think that focus on the resident is so important. And Romy, you work a little bit more in a similar space in your current role that I think the Enterprise National Program does as well around health and housing and trying to forge more cross-sector partnerships. But oftentimes it's difficult to make that connection in those conversations, and bring in that resident voice to these conversations that are happening over Zoom and over, with the business offices at healthcare organizations. So I think it was just beautiful timing that NeighborWorks released a report looking more into the cross-sector kind of investment in affordable housing, and you're able to touch on that and touch on an approach to bring in the resident into those investment conversations. And so if you could share a little bit more about how you're seeing this play out or not play out when you're seeing investment into affordable housing, and how you're suggesting this might be done differently in your most recent report, that would be great to hear. And I will share a link to that in the chat as you do so.
Okay, great. Thanks so much, Mary. Yes, so NeighborWorks America, in partnership with the Center for Community Investment, we did a year-long exploration with 6 of our network organizations across the country around. We wanted to really understand, how do we support affordable housing and community development organizations partner with their local healthcare partners or entities, which could be a health plan, it could be a federally qualified health center, it could be a hospital, it could be their public health department, with the explicit purpose of investing capital, loan capital dollars into the development, preservation, rehabilitation of affordable housing. And I think one of the things that really, I think, got pointed out with John is that sometimes with health institutions, they are very focused on health outcomes and, how does our investments drive health outcomes? And even from my own experience being in the room with health partners, asking those questions, sometimes I think there's a little bit of a mismatch of expectations around driving health outcomes to the work of affordable housing and community development that we need to be mindful of for. And part of this, and I really love, Amanda, enterprise and your work and your commitment and focus to residents, just as we are at NeighborWorks America, and our actual founding of NeighborWorks America was by a Black woman. Our inspiration, I should say, for NeighborWorks was a Black woman, Dorothy Mae Richardson in Pittsburgh, who rallied residents against very strong institutional players coming into their Black neighborhood in Pittsburgh, and basically using different tools to get rid of their community or remove their community in place of things that are not for community. And so that's at the heart of what we do. And so I think what we're really trying to offer in the toolkit is, it's a readiness toolkit, and it's about, how do you center the voices of community in this partnership around addressing health outcomes. And one of the things that we recognized is that sometimes the motivations between healthcare and housing is different, and sometimes that those motivations from affordable housing community development, because the health sector often has a lot of money, they have trillions of dollars every year, is that the motivation for connection might be around health outcomes in the immediate, or it could be motivations around just getting their financial money. But actually the motivations that we're really trying to drive is how together health partnerships plus affordable housing community development, how is that actually rooted in addressing root causes? And from a partnership of addressing root causes that have been identified by residents, how can you then improve the conditions of the neighborhood by then improving health outcomes? So it's a little bit of a shift in trying to move from more of a internal silos to a transformative collaboration. And from that point of view, if you're really holding a different viewpoint about residents and communities and what their barriers to living a healthy life, you can actually frame up something much bigger than just one development project or one program, because you're really thinking about our community that we serve, that we work in partnership, needs so much more to achieve a healthy life, and thinking about those series of investments that are needed in partnership to make that happen. So that's what that toolkit's about. It's about that journey and how to get you on that pathway. And then also at NeighborWorks, we're exploring a community health worker model, and really looking at how does community health workers in larger comprehensive community development initiatives, as well as in resident services or cross-training resident service coordinators as community health workers, how can that help address individual barriers, but in the aggregate really start to think about what can, in partnership with other organizations or with healthcare entities, what can we do to really address the root causes behind what we're seeing with residents in housing, and how to use that as an opportunity and open door for those partnerships to yield improved conditions in community and long-term better health outcomes.
Great, thank you. Yeah, I mean, and when you're talking about those root causes, something that kind of laid those um inequities bare was the pandemic. And there was a lot of action in resident services then, and its power to improve health equity during the pandemic. So I'd like to ask you both a question about that. First, Amanda, um, how did resident service providers in housing step in during the pandemic to meet critical on the ground needs and fill in many critical gaps to serve residents in their buildings?
So I would definitely say there's a few things. It was kind of an all hands on deck approach by far. And while we were all in our various kind of seats and lives experiencing the pandemic and adjusting as we went, also trying to be as agile as possible, because we were, shifting from, the assumption that this was just going to be a short term, like, oh, we're just going home for like a week and we'll be back in the office, to the realization that, this is going to be reality for a prolonged period. And very quickly understanding, by way of loss of access to interaction, increased isolation, lack of access to healthcare providers, because, as we all can just reflect on how everything kind of flipped on its head, as much as possible, what can we and how can we shift to be able to extend as much as we possibly can. And so I think every organization, by way of either leveraging kind of the success it had with certain programs, doubling down there, if they had food security programs and partners that were able to get more out to community and beef that up, doing so. If we had strong partnerships with healthcare providers or organizations and pharmacies, getting vaccine clinics in, getting information out that was most up to date and relevant as possible, doing wellness checks for our senior residents and our vulnerable populations, supporting families as education obviously was impacted as well. And so if you had a grant for an after school program and the students couldn't come downstairs, well, then what are we doing to be able to provide as many supports as possible to try to be as good stewards of this dollars? But more importantly, beyond obviously the funding, is being a support and a partner and like a connection point for our residents when a lot of that felt lost. And so more than anything, I think it was just that trying to be creative, trying to think outside the box, trying to, quite frankly, survive in many levels, both personally and professionally, but also leverage the relationships that we already had established in community to be able to bring in a different type of support and connection that was most relevant for our residents at that time.
Thank you, Amanda. And Romy, going to you on the pandemic, what can we learn from this crisis that can be applied to our approach to public health in the U.S., particularly in moving us towards a more equitable approach?
Yeah, and Amanda, you highlighted so much of what we heard from our network about how they responded to the pandemic. And I, as we've been thinking about this at NeighborWorks, and we've just started a process of talking with many of our network to reflect on their experience of the pandemic thus far and try to do some sense making. And part of it, the sense making part of like what's happening has been hard for folks because we're still in it and they're still in it in different ways. But I think one of the things that really got illuminated that is really important to me and to this work and some of the learnings is how much the work was essential workers and how resident service coordinators, affordable housing community developers were kind of left out of that bubble of essential work. And through these conversations with our network is that we really heard three critical roles that that the network played, and one was a trusted partner. And I think, Amanda, as you were sharing, like many resident service coordinators, many organizations, there's like just not only responded to needs, but how to respond to misinformation and questions about COVID and would the, would the vaccine implant and chip in me? Like there's just a lot of information on top of having to translate information, and then funders, just kind of like, what do you need? Just like, here you go, we trust you're going to deliver. And then even, government entities or political leaders reaching out and saying, what do you need? So I think that piece of being a trusted partner is really important, and what was needed when there was so much information, so much worry, there's so much chaos, and making sense out of order. And I think organizations really stepped up in that way. Also being a community anchor, and that was, Amanda, like creating programs and services, addressing needs, making sure that businesses didn't close, maybe losing money on parts of the portfolio just to keep people housed or just to keep people, their businesses open, or recognizing that if the business community, like one of our organizations, Chinatown Community Development Corporation in San Francisco, were really worried about the local small mom and pop sort of Chinese restaurants. And so they really worked and developed their own World Cafe food model to bring money in and make sure those businesses stayed open, and then make sure the residents in their communities are fed, stay well. So I just think about being that community anchor and taking that role and thinking creatively about transforming hotels into permanent affordable housing that were underutilized. And the last was a stabilizer, and in so many different ways, from meeting basic needs, starting food pantries, doing PPE, stepping up where other organizations are. And so we really have learned those key critical roles of being a trusted partner, anchor, and stabilizer are so akin to public health infrastructure, and really keeping, communities, particularly low income, people of color, folks with special need, stabilized throughout a pandemic that still is going on.
Thank you, Romy. I think that both of those perspectives were really helpful in painting the picture and telling the story of the role that resident services really could play to public health infrastructure, as you touched on there at the in your response as well. So I'm going to try to kind of combine a question with a question / comment that we received from the audience. And while I do, we may have a few minutes. If anybody listening would like to enter another question for the panelists, please feel free to do so, and we'll try to get to that. But when we're really thinking about that sustainable funding of resident services and integrating it more completely into our public health infrastructure as part of the way that we work with communities on the ground and center the resident, it just, to me, seems like there is so much power in that approach. And there's opportunity to work with other partners and MCOs and healthcare and things like that. But as Kathleen mentioned, it's really even going a level above that. And so I would love to hear from Amanda and Romy, you both, a little bit more about, if we start to think through that, that vision, what gaps do you really think need to be addressed as part of it? And what long-term vision would you set for us in this work? Is that a big enough question for you? Because it feels really big.
Amanda, do you want to go first, or do you want me to take a first hit?
Sure, I can go. I can hit gaps if you want to hit long-term vision. Sure. Put your public health hat on. So from a gaps perspective, so for those that may not be familiar, the work of resident services has like multiple layers of support. It runs from contributions directly from the actual property where we're serving, to investment, by the investors into those deals that then results in some kind of like trickle support for resident services, but with the majority kind of supporting the actual development. We have our corporate support by way of our organization, kind of alignment with the mission. And then there's the fundraising, the partnerships with key organizations, and volunteer and in-kind support. And hopefully all of that gets to like a full kind of package to to meet all of our needs, but quite frankly, even in this moment, doesn't, before we then try to think bigger. And so the thinking bigger part is great, because where we can start to get kind of, I'll call them larger systems, better aligned to be able to kind of work in partnership to support one another. If either side hasn't been able to kind of close their own individual gaps, then we're looking at kind of a bigger ask and a bigger kind of like promotion of where there might be some thinking for additional investment to support those models. And so I think from my lens and my seat in resident services, we've had opportunities previously to be able to look at some of this collective work together. But if it starts to result in too large of an ask of an organization where I'm in the department that is not the money maker, we are the mission realizer, but the expense, then it becomes very difficult for me to be able to ask for additional investment from resources that are often already strained.
Yeah, thanks, Amanda. Having worked in organizations, I know that's definitely a case of the mission maker versus the asking for expenses. And I think that's a really important part of the learning internally. And I think it's also easy to get into the we're raising all this money, we get developer fees, and then there's property management, but then we pay for this. And I think it's, as part of the briefs and what, John mentioned was how we can really recognize that stability aspect. And when we hire resident services coordinators and they're able to stabilize housing, how it reduces costs both on the organization, but it also reduces societal costs. It prevents homelessness. It prevents so much other things that happening. People feel connected to community and improves health outcomes. So I think there's more that we can be blasting out in that learning orientation. So that would be definitely one part of the vision. I think the other, piece in this larger health and housing and thinking about the work of resident services coordinators, the work of affordable housing and community development as public health infrastructure is sometimes is sort of also investments in building our understanding and capacity to be a little bit different in this space. I think one of the things I know that I have struggled with in my work and have continued to work on refining is how to listen differently to residents and how to really take time to hear their point of view and really get beyond ourselves about my role in my work can only do this and address this piece, but the work that we're doing with residents, particularly residents that have been affected by so many adverse things, is that they need many supports. We all need many supports to live our healthiest life. And so I think one of the things that I've been really focusing on, and here at NeighborWorks we've been focusing on, is how do we get more into facilitating discussions where we are really not just getting resident input, that we're really finding ways to empower residents or finding ways to work in collaboration with residents to not just identify the problem, but to be a part of the solution and removing those barriers, whether that's individually for themselves or if that's for more wider community opportunity. And I think when we create more of those opportunities and we continue to provide services, supports, and programs to residents, but also address more of those root causes about why, and we understand how health has happened in this place and what are the real other issues that we have to work on and how we might have to collaborate and work with others. I think that's a really huge opportunity that is both public health, but it's also moving a larger frame of public health and moving upstream into the social determinants of health. So I think just part of this vision is, how do we work collaboratively with others? How do we bring investments for the collective work? How do we communicate and shape our work? But also, how do we build our capacity to really center, hold ourselves when we aren't listening and figure out how to listen and how to make that part of our vision. Because when we do that, not only do we get better as practitioners, our residents feel like they have more efficacy over their lives, and that is a health outcome as well.
Great, thank you so much. And I think that we are right at 3 o'clock, and that is a great note to wrap the conversation up on, because we are speaking towards systems change, but we want to, and I think one of the greatest opportunities here is that resident-centered approach that resident services and within housing-based services brings to the table. And that if that could be done at a larger scale and across the board, we have so much opportunity to improve outcomes. So there's so many people to thank right now. Thank you, everybody who joined the webinar. We really appreciate you coming and joining us and listening and being part of the conversation. Romy and Amanda, thank you for offering your insights and your expertise around this work. We really appreciate having you. And I hope that folks will check out both the issue briefs that Enterprise has developed in partnership with Dynamic Solutions and with funding from Wells Fargo, as well as the report that was shared during Romy's remarks. And we'll try to follow up with all of these resources, as well as a recording of this webinar in case y'all like more information. But always, Enterprise is a very collaborative organization. We love for things like this to spur additional conversation. So please reach out to us if y'all are doing this work and want to continue the conversation outside of a webinar setting. So thanks again, everyone, and look forward to seeing where this conversation goes. Great.
Thanks, everyone.